We're going to show you how we're going to do it, okay? Right from loading it until we finish it, okay, on the different parts, okay? So you have the pack here, okay? You have the pack, it comes with 5, you know, it comes with 5 or 10. It's called HFR, you know, this will be for the beard. We also have for the skin. We also have for others, you know, we have for different formulas. So which one are you using now? Okay, never mind. Okay, and you're using it for the skin, right? You have to show, you know. So what I did here is like this. There's a label here. I remove this label. After I remove the label, there's a cap here. I will peel off the cap. It's so easy. I just peel it down. When I peel it down, it will go down, and then you have this rubber stopper. This rubber stopper, I can open up the rubber stopper, okay, with my hands, and I will use a dropper. Where's the dropper? Okay. I will use a dropper which is provided to you, okay, free of charge. You load it in, okay? So you suck it out, okay? You suck it out and you load it into the stamper. So this is the stamper, right? Okay? The stamper cover, I load it inside. Okay, you see I'm loading it inside. So I load it. But if I'm a medical doctor or aesthetic doctor or the nurses, I can use a syringe. I use a syringe with a needle. I use an 18-gauge needle and suck it out, you know. So this is what I did. Okay, I can buy this from the pharmacy too. Okay, I did it here and I use a syringe. I can easily extract this out, you know, extract the whole liquid out easily, you know. So I extract it out, you know. With the extraction, I put it back to the stamper. Okay, I load it back to the stamper. I'm not going to inject with the needles. Okay, I load it back here. I close the cap. So this is a cap, right? You see the cap? Okay, so I'm going to close it off. I close it off, okay? And the liquid is inside. So what I did is I start to stamp, okay? And you can even show to the clients, or let's say your client or you yourself, you're doing it. Sometimes you can test on your hand first. Painful or not, no pain at all. Okay, despite this is, so this is 0.75, no pain, no blood, nothing, okay? But you see the hands is wet, that means the liquid is done in such a way that, so what you did here is that you can easily stamp on the hand, which part you want. Okay, I'm asking my nurse to stamp. Just stamp on any way you want it. No, just stamp on every part you want.
Yeah.
Okay. Okay, just stamp. Okay. That's all. Okay. So you stamp on any part you want to stamp on. That's all. Okay. What about the face? The face. What is the size of this needle?
0.25.
Oh, this is 0.25. Okay. 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 For the face, what I did was like this. Okay. I can stamp on my face on where I want it. So I want a good texture on my face. I stamp it all over. And when I stamp, each time is 20 needles. Okay. So that's how I did it. Then what about my neck? You notice you have some neck, right? You can stamp on the neck too. You know? This is what you're stamping on. This is the actual needle you will be stamping on. Same for this hand. Same for the texture here. If I want to improve on my textures, that's how I do it. Okay. So it's not really that difficult at all. And what happened after this? When this one is empty, I'm going to wash this off. Okay. I wash this off, you know, and then I keep everything back into the fridge. Okay. And I can put on a small container or with a zipper bag, you know, and put it up, you know. So anything else? That's simple. So do you think it's difficult to do this? It's not difficult at all, right? It's not difficult at all. Okay. Now, eyelash. Same principle, the applicator, you see? You load this, you explain, you load this, okay, this is the liquid, okay, you drop it here, okay, you put it into the eyelash. How do you put into the eyelash? This is Marcella, one of my nurses. She's doing it on herself, okay? Lower eyelash, both, yeah. Now, again, the liquid, if it got into your eye, it won't harm your eye. There's no sensation. There's no sensation. These are natural extract. It won't harm you at all when you go to the eye. So that's it, and you only need to do it maybe once a day. You don't need it to do it so many times. You only need it once a day. And there's a question here. For eyelash, it has to be applied into the in-between. Okay? That means you go in, and go in both sides. Okay? Wherever you want to grow, you apply on it, as simple as that. All right? I noticed there's a lot of questions here. There are 18 questions here. Can you put into that? What other questions? Can you go through the question? So do you have any other question to ask from here? Anything else you need to ask me for? Neck, no problem. Okay, stretch mark. Okay, stretch mark is also very easy. Okay, stretch mark is again using the same needle, but this time we have it's the same type, but we have a 0.5. Okay, 0.5 means I can actually, you see, we have a different size here. If you notice, the packaging have a different size. Okay, you notice there's a 0.5, 0.75, 1.0, right? So this is how we will give it to you. So you'll be very sure you're giving the right stuff. You won't be giving the wrong stuff. Okay. So for the stretch mark on the lady, what you have to do is you just punch it on the place you want. Okay, just on the place you want, and that's it, And then for the stretch mark below or whatever, just punch on the area they want to do it on, Scars. Same situation with scars, because with the scars, again, you can kind of just punch on the area you want to repair on the scars, okay? And the other thing I would like to tell you is that we also have a roller. That means instead of punching, we are coming up with a roller, so you can roll it up your face. That is something new coming up from us, but it needs a bit of time because of the COVID. So you can roll it up, upwards. So instead of punching, you roll. Same for the stretch mark, you can roll. Either you punch or roll. The effect is the same. For the eyebrow, normally we will just, punch on the eyebrow. For the mustache or the sideburn, we just punch on the sideburn, So that is how we go with all this. So any questions so far? Okay, there's another one. Can you advise on stretch mark on body, buttock, tummy, which size of stempel to use? Now, again, like I say, on the buttock, or the tummy, you have more skin there, okay? You have more fats on the tummy, right? More fats on the tummy. So, of course, we have to look at we will ask you to use only 0.5, okay? We will not ask you to use more than that, but sometimes if that guy is having a lot of fats, we may also move to 0.6. Or in the worst scenario, we can try 0.75. Okay, but we will never give you 1. Only for the doctor, we will give 1, okay, or 1.5. Okay, but not for non-doctors. We want to play it very safe. We don't want you to run into trouble. Okay, so that is the way. Now, eye bag. That is a very good question. Okay, for eye bag, I would not say it worked that well. Okay, for eye bag, in my opinion, it won't work that well. But when you say eye bag, we have other solutions for eye bag. Okay, we can come up with other solutions, but not this product. This product will not work very well with eye bag. You have to understand with eye bag, sometimes there could be also a lot of loose skin when you have a big puffy eye, So if the situation is very bad, then obviously you have to remove the excessive skin, okay, because that is excessive skin. Okay, can we treat totally bald male with stempel and the product? Okay, this one can move up already for a while. Just put it over there. Can we treat totally bald male with stemple and this can push that? Yeah. Now, totally bald. That means there's the shining already. Like I say, anything shining is difficult. Anything which is shining is very difficult to trick anything shining. That means you don't have the follicles anymore. So when you don't have the follicles anymore, I don't think it works. Okay. So when you start to have an M shape going up or from the back here, going down, you have to start punching already before it becomes bigger, because you will go big very fast. Okay. So when you start, you have to start to prevent it from losing all, you have to start growing. Okay. Can you check what other questions here? There's a number of questions. Any other questions? All products must be refrigerated. Yes, all products must be refrigerated. What kind of ingredient used? Now, in the PowerPoint, I already explained, different products will have different problems. Okay, different ingredients, different application will have different thing to use. So it go according to a person, whether it's a male or a female, and we will blend according to that. Okay, so we have different formulas actually. So like I say, it's for a female baldness, okay, or a male baldness, or eyebrow, or eyelash, or beard, or mustache, or neckline, or chest line. Now, don't forget the chest line. The chest line is exposed to the sunlight. So if you look at a woman, sometimes they take care very much of their face, but sometimes they forget a bit of their neck, okay? And they forget a bit of their chest, because the neckline, you're exposed to the sun. So what is important here is that we have to be aware that you must take care, because when you look at the person, you also look the face and the neck and the chest line. So that is also aging. So you need the SPMCE plus the H, to do up some repair there, to apply with the hyaluronic acid to improve, okay, on the texture there too, okay. And any other questions? No, when it's bald means, or there's no hair follicles means we can't do anything when it's bald, okay. Any report of adverse reaction or allergic reaction? Now, so far in our history with the products we have been using, now please bear in mind, before the products come into the market, we have to test them for many times. And we test them for safetiness with Heidelberg University, one of the oldest university in Europe, well known for cellular therapy. And our products are all tested for safetiness and toxicity at this moment with Heidelberg University. And that university has been existing since the 14th century, one of the top universities in Germany and in Europe. Okay, Dr. Nick Zailan was asking, is it correct to use female placenta for male hair rejuvenation? The answer is yes. For hair, for the male and for the female, you have to use female. You cannot use male, because you can use the male, but the result won't be good. It has to be a female placenta. It has to be a female skin and together with the mesenchyme. Okay, the combination is different. Now, remember, I did mention we have a vegetable formula. It's on the way coming. But so far, not many people is asking me that I need a vegetable formula. Although we have a lot of vegans who take our vegan supplements or we insist that we must be vegans, So we are bringing them in to also give a service to the clients who insist they don't want the animal. But so far, I would say everyone is asking, they are not bothered whether it's for the animal base or non-animal base for the hair, So,
we have one question, Prof. Mike,
okay.
Which is from Yolanda. How much product do you use per square centimeter?
Now, put it this way, okay? If we are talking about the face, okay? I mean, you are punching on that area, but you also want the next area to be punched on. You just punch accordingly. But you cannot be measuring exactly, okay? It's only an estimation. Let's say if I have punched here, okay? But I also want the other side, right? I will punch with my own estimation where I want it. You know, this is how I punch. You see? So that is how we go with it. Because you're not only going to punch once, remember? Okay, you're going to punch over it, and then the next time you use it, you will punch again. So I cannot say you punch exactly because there's no guide there, but you have to use a kind of estimation. Okay. Now, again, for the hair, I would not encourage everyone to punch all over the hair because some parts you have a lot of hair, like my hair, a lot of hair, I don't have to punch all over the hair. I only want to punch on certain area, maybe there's the hairline. When you comb your hair, there's a line there. They will tend to lose more hair there, right? But some of us male, we also have the M shape. So you better don't make the M shape go too high up. So you have to start punching there because you go by the M. And some will go by the top here going down. Okay, but the back of your hair is always there. You will never lose the back of your hair. Just bear that in mind. You can lose all the hair, but normally the back is not lost. Okay, so again, there's a question here. More vegetable-based supplement will be available from your country, from your company. Yes, we have a full range of vegetable, just like we have organ-specific injectables or therapeutics or supplements. You know, we also have it for vegetable because we are one of the first people who do vegetable phytostem cells in Germany in the form of injectables for the last 30 over years. Okay. We have 54 products of vegetable-based injectables approved in Germany by the German FDA. It's just that we didn't bring into the country. Okay, but we also have a lot of cosmetic applications. All our cosmetics and supplements are made in Switzerland. So we are bringing them into, okay, to make it having a bigger range of products for people to choose. Because these days, people have different choices. So the choice must be large enough, okay? But again, I have to give the answer for certain things like when we talk about organ specific, okay? If someone say, I need the pineal gland for sleeping disorder, then if you are to give just the melatonin supplement we buy outside, or you give a real pineal gland, or you use a vegetable-based supplements to work, I will always say that the real one, the pineal gland for a pineal sleeping disorder will work better, okay? Because if you were to say you buy something outside, it's exogenous, it's external, okay? That means it's not the organic type. Although they say it's for organ-specific problem, it will not work totally as good as the one with the animal in that sense, okay? So it depends on the condition, what sort of condition. Okay, there's another question. Does this treatment for whole life or just when you get result, you can stop and the results still appear? Now, this is a very good question. The answer is you only need to grow that hair, activate the root hair follicle to be healthy on that and let it start to grow. When it starts to grow means it will continue to grow. Isn't it? Even if the hair were to fall off, it will continue to grow. As long as you have good nutrients for the hair. The good nutrients from your hair come from your supplementation of your food and your lifestyle. Okay, but if you're smoking, you're taking a lot of canned food with heavy metals. Okay, also the veggie is not with a lot of heavy metals. Obviously, you will lose hair. Okay, then after a certain time, you will not grow the hair. So if you find that you're losing the hair, once it start to grow and you grow to abundance, you don't need to do any more. Just like I'm telling you, I didn't do it for 3 months, because I don't need it. I find it's too thick already. I have to trim off before I go and grow hair some more. But again, I did told you and show you that I'm losing hair. So you take note of your hair you lose every day. If you keep on losing hair, this is the time where you must do something. Okay, because if you don't do it, every day you're accumulating the hair loss. So obviously then later on there'll be some patches here and there. Okay, and the patches become bigger. Okay, so my answer is that you will stop when you don't need it. You don't need to continue taking it until you start to lose hair again. Then you have to start taking it again. Okay. Approximately how long you will start seeing the differences result. Now, the result is so fast. I can tell you it's so fast. Even by the 3rd week, you will see some baby hairs. I actually have a PowerPoint, which my staff didn't put it in there, where we took with a cell phone, we can see some baby hair coming up, baby hair. I can give you the picture if you want to. I can send it to you again if you need it. Okay, just text me. I will send you the picture of one of the patients. It was one of the patients in the picture there. We have baby hair of him growing up. I also have a picture. I also have pictures of American patients where we treat ladies, blonde hair ladies who want thicker hair. They're also losing hair. And the good part is that you have nothing to lose, isn't it? It's either you grow hair or you don't grow. If you don't grow hair, obviously you will not come back to the sponsor. You will not buy anymore because you don't see the results. You don't see anything, okay? But you do see the result. You see some tiny baby hair coming out. So obviously you know it's working, okay? Then you will come for more. Okay, then you say, I want more. I want faster hair growth, So that's how it goes. Okay, now, so I say 2 to 3 weeks. So any other questions? Now, supplements is the same. If you take the supplement, expect to grow hair, it'll be much slower. I have to be very honest with you. You must punch it into the hair because it's direct on the area. It's just like your face. You want to have something good for your face, you normally will do the treatment on that face, that area. You have pigmentation on that face, you do the treatment on that area, okay? But you also have a pigmentation on your skin, this area. So you will do the pigmentation on this area. You will punch it on the place where you have discoloration. But if you are going to take a supplement, you have to understand supplements, as you go into the digestive system, it needs time. And when he goes with the digestive system, you have to work for the whole body. Okay, it's for the whole body. But in a way, the supplements will complement the treatments, the direct treatments you're imposing on your hair, on your face, or on your neck. So you have a direct treatments and you have something which work into. You have to do two parts, external and internal, for the best results.